I've already booked an appointment for my doctor. Her name is Nurul.
Okay, yes, today she has an appointment with the doctor. Please be seated. The medical assistant will be coming in to see on you.
Thank you.
Okay.
Good morning. May I know who's the patient?
My daughter.
Okay. What are the symptoms she's having?
She's having sore throat and fever.
Oh, okay. Wait a while.
Yes, come in.
Good morning, doctor.
Good morning.
There's a patient waiting outside, and she's claiming that she's having sore throat and fever.
Okay.
She has made appointment 2 days. She has made appointment online, and the appointment was 2 days in time. But the pain is getting severe, and she has been going for a few days.
Alright. Bring the patient in, please.
Okay, sure, doctor. We can see the doctor now. Follow me. Come in.
Hi. Good morning. Oh my goodness. Hello.
This is the parents, is it?
Alright. What's wrong with your daughter? My daughter is having a sore throat and fever. Okay.
And it has been going on for 5 days.
5 days. She also have difficulty in breathing. Could you check up on her?
Of course, of course. Hello there. How are you feeling? No, I feel myself so throat. Then I also have a fever. Then I feel like my neck is hurt. Then at night I feel
No, don't cry, don't cry. It's okay, your heart is beating fast, is it?
Yeah.
Alright, chill, relax. Okay, take a deep breath. Alright, take a deep breath. You don't cry. It's okay, don't worry, okay? Alright, the parents, has your daughter been on any special medications for these past 5 days? No, and no specific antibiotics and whatnot?
Yeah.
Alright, Miss Nurul. Please take a deep breath, okay? Don't cry. You're a big kid now. You're 9 years old, right? Here, have a cat. Yum. Okay. Let me explain this to you, Mr. and Mrs. Ikmal, right? Based on the medical history of your daughter, I have found out that she has received hepatitis B as well as BCG vaccination when she was during her child. Is it? That's correct, right? Okay. Because based on what I heard in her story, I suppose this is a bacterial infection. Okay, this is called Corynebacterium diphtheria. The symptoms that she mentioned and the ones that you mentioned earlier, along with her situation right now, is interrelated to this bacteria. So what I'm just going to do, just to double confirm with her diagnosis, I will perform a throat swab. Basically it's a very simple procedure. The sample will be collected inside the throat here, and then just to confirm the diagnosis, not to worry, your daughter won't be admitted. There's no need for her to be admitted in the hospital. But once the procedure is done, you both can go home. Alright? Is that okay?
will be careful.
No, my dear, it won't hurt you, I promise you. I'll do extra careful. Alright? Alright, no problem.
And this treatment will be okay for her?
It will be absolutely 100% fine.
The procedure won't hurt her, right?
It won't hurt her. You have my words. Alright? Diva, can we proceed with the throat swab collection procedure? Alright. Your procedure is done. Alright, let me check your heartbeat first, okay? Heartbeat is a bit fast right now. How are you feeling? Can I check your blood pressure first? Alright. 50 by 90. Really fast. Alright. We'll proceed with the throat swab first, okay? Open your mouth. Wider, tongue out. Alright.
Alright, satu.
First, sterilize the workplace with 70% alcohol, then turn on the Bunsen burner. Then took the throat sample of the patient and culture it on the blood agar. Again, sterilize the cotton swab. Next, take a clean glass slide and put a drop of saline and sterilize the inoculating loop. Then, using the inoculating loop, take a patient's sample and mix it with the saline and let it dry. Once the first glass slide have dried, then did the gram staining by first adding crystal violet and let it be for 1 minute. Second, adding iodine and let it be for 1 minute. Then add acetone and let it set to be for 30 seconds. And lastly, add safrarin and wait for 1 minute. Then wash the back of the glass slide and pat dry it using the tissue. Second glass slide with the sample did an Albert staining by first adding Albert stain A and let it be for 5 minutes. Then add Albert stain B and let it be for 1 minute. Again, wash the back of the slide and pat dry it with the tissue. Observe the slides under the microscope. Again, take a clean glass slide and add the patient's sample and smear it. Then add hydrogen peroxide to test for bubble formation. Serving test was for the methyl red test. Then take the patient's sample by using the inoculating loop and stir it in the broth medium. Then cover the tube with the parafilm and incubate it. On the next day, add 5 drops of methyl red to observe the color changes of the broth medium.